Hi, today we had this webinar which got disturbed, and this disturbance was because of an emergency. A patient came over and I had to just take it over from there and exit the webinar. However, for the purpose that it was and for the purpose that it should have been, I am sharing this webinar commentary right here. I was to discuss what is the critical application of arm dosh to various inflammatory and autoimmune conditions. If I look at them, arm dosh, the significance of arm dosh is that it is a toxin produced in the body as a result of impartial digestion or incomplete digestion of foods, and this is supposed to take place in such a manner that it further blocks the channels of the body, some of those being physical like your arteries, veins, ducts, or non-physical ones like nadi. It further says that if you look at them in the perspective of modern biochemistry, there is no specific label, there is no specific reference to arm. However, there is an observation that most autoimmune conditions or conditions of immune compromised states because of infections, there is an association that you see a change in pH, usually a decrease in pH, and this is acidification. This acidification is correlatable to what arm is. If I were to pick it up in form of few examples, I have an example of rheumatoid arthritis where we have various joint structures like collagen, like bone, like synovium, like cartilage. Each of these is involved in degradation, in damage when it comes to rheumatoid arthritis. In case of rheumatoid arthritis, what happens, and it is believed that osteoblasts, chondrocytes, monocytes, macrophages, B cells, T cell subsets, fibroblasts, all these get involved, and there are different markers like cell signaling markers like pleiotropic markers, pleiotropic cytokines, then you have a range of interactive events that happen, and each of these events, each of these fragments, each of these segments causes changes in the local structure of the bone, in the local structure of the joints, such that there is inflammation, there is a response that brings up a change, and that inflammation, that change is usually accompanied by an aggressive metabolism at the local site. This aggressive metabolism at the local site is seen often to occur along with substrates which are stored in the local tissues as energy reserves, that being glycogen. Glycogen by itself is a carbohydrate derivative, and it's a emergency need. It gets converted to sugar, and sugars then generate energy. This, when under stress, usually takes place in anaerobic states, in partial states, through various carbohydrate pathways like oxaloacetate pathway or maybe the pyruvate pathways, and these byproducts therefrom, which turn acidic, cause inflammations or local injuries resulting in inflammation and edema. Same is the case if you want to look at it in terms of psoriasis. Psoriasis also follows a similar pattern. Psoriasis also accompanies a similar pattern, and this similar pattern is visibly seen to cause similar kinds of injuries and similar kinds of changes as were in rheumatoid arthritis. A similar extrapolation has also been seen in case of IBS. If you look at a close relationship between these changes, between the way it happens, you will find a dependence of it on impaired functions of thyroid or altered functions of thyroid gland as well. That is not to say that thyroid functions are a part of this, or that is to say it is yet something that has to be explored, that has to be really defined. But the role of thyroid gland definitely is important if you want to analyze or see what happens in case of ARM production. Now, if you have to further go by, you will find that these inflammatory responses, these inflammatory changes also have an association with mitochondrial activity. The fact that mitochondria produce energy and they are the baseline or the powerhouse that backs up all the energy metabolism, all the functions that happen within the body at the cell and tissue level. There is definitely, when an autoimmune reaction happens, when an infection happens, when there are changes to pH happening, a stress that comes upon them to generate more and more and more of energy. That means that mitochondria are also prone to damage, prone to injuries, and when the requirement is high, even prone to stress. This condition of mitochondrial stress is definitely close to what ARM actually causes. Therefore, ARM dosh or existence of ARM dosh is very much relatable to mitochondrial stress. The best thing that can help, that helps reduce mitochondrial stress, is sleep, because sleep allows the body to come back to a point where it can repair itself. Another element is balanced diet. Now, balanced diet is not about having adequate amount or measured amounts of carbohydrates or fats or proteins. Rather, beyond that, into measured amounts of micronutrients, such that you are even in terms of balanced diet, you don't enter into a state which is imbalanced. So you have to be careful. And the third thing that is important is that you live with nature as it is. You should be able to imbibe nature, you should be able to adjust yourself according to nature. When you have these things, there is another element that comes into play as professionals, that there has to be a work-life balance, an adequate amount of sleep, a proper time of your meals. All these go on to play. When all this is in proper fashion, in sync, the stress will be reduced, acidification will be reduced, the inflammatory responses will be less, blocking of channels will be missing, and overall there will be a state of healthy well-being. This state of healthy well-being is what will help you overcome ARM dosh, overcome mitochondrial stress, and have a healthy long life. Thank you.